All right. Hey guys, what's up? My name is Stephen Dunn. I'm a licensed physical therapist. This is Dr. Andy. Today, we're going to talk a little bit about something that I know nothing about, and it's called visceral manipulation. Now, I've been a physical therapist for maybe 26 years, and 26 years of doing manual therapy. I've heard of visceral manipulation very little. I do some work that is deep that people have said, oh, this reminds me of visceral manipulation, but don't know much about it. But guess who does? Dr. Andy. So Dr. Andy just took this class recently, and he's in a series of 6 classes to learn this whole system about visceral manipulation. So first of all, what's up, Dr. Andy? How are you, man?
Hi, good. How are you, Steve?
I'm good. Good to see you, man. So first of all, tell me a little bit about what the heck is visceral manipulation.
Visceral manipulation is a manual therapy approach created by a osteopath. His name is Jean-Pierre Barreau. And so it's taught through the Barreau Institute. The philosophy behind the method is that all the viscera or the internal organs we have, they have their own movement, that when the smooth muscle is contracting, it will induce its own movement on its own. We call that the organ's motility, as well as the mobility of the organ that's being affected by our breathing, by the heartbeat, by our voluntary movement. That would somehow cause the organ to glide or shift a little bit inside. That's called the mobility of the organ. So there might be many different conditions that would impact the normal mobility or motility of the organs. And so visceral manipulation is the technique that is intended to find and restore the mobility and motility back to the organ. So what it's going to do is to apply a very gentle pressure or induce a very gentle tension on the organ so that it will create a little bit of the slack in space for the organs to have more space to move on its own. So the spontaneous movement of the organ to be generated, and then the mobility and motility can be promoted that way. So it's a little bit different to a lot of the idea of many other treatment approaches to be able to move and heal on its own. So it's different.
Let me ask you, who would benefit from visceral manipulation? Like what kind of person? Someone suffering with what?
That's a very good question, because we as physical therapists, our goal is to help people to move better and to be able to perform their functional activities, their everyday activities better. It's still gonna benefit those people who are suffering from limited ability to move. And one thing that's worth paying attention to is that a lot of time there might be a visceral components to it, just like a lot of people are not realizing. And that's specifically true for anybody who ever had any abdominal or pelvic surgeries or any inflammatory condition like an infection or an autoimmune disease, or ever being involved in a motor vehicle accident. A lot of those conditions can cause tension, guarding, or adhesion to the soft tissue, the fascia around the internal organs, or even the internal organs themselves. And visceral manipulation will be able to help that way. But then the goal is still whoever is having limitation to their movement, it's worth to explore and see if there's a visceral component to it. So if anybody is having any condition that's very chronic, bothering them for many years, tried many different things, nothing is helping, those would be the people that usually can benefit from that.
This is part 1 of our Visceral Manipulation series, and we'll be back with more to teach you more about this and what it is real soon. Y'all take care.
Bye, everyone.